let's get onto the streets, people, quite literally. I am delighted to introduce our next speaker. Her name is Lucy Saunders, and she is a consultant in public health at the Greater London Authority and Transport for London. This is essentially the job I wish I had. But she leads on the integration of transport and public health, and she's worked in the NHS and with local authorities, the UK government, even with the UN. And she's currently, I understand, implementing TfL's, in fact, the world's first Transport Authority Health Action Plan. Let's welcome her, Lucy Saunders.
Hi. So as a public health specialist, my colleagues often ask me why I've chosen to go and work at a transport authority. And the reason why is that I believe that Transport for London, as a single organisation, has more influence over the health and well-being of the population of this city than any other. And that's why I'm there. I'm going to tell you a little bit about what we're doing at TfL. I'm sure many of you will be aware that we've got a bit of a physical inactivity crisis on our hands. At the moment in London, only 6 in 10 adults are getting the bare minimum physical activity that they need each week. Does anyone know how much activity an adult should be trying to get on a weekly basis? Yeah, it's 150 minutes a week, which can be 30 minutes on 5 days of the week. So it's not a huge amount of activity. But at the moment we've got 4 in 10 adults and even more shockingly 7 in 10 children who aren't getting the bare minimum activity that they need. But the people we know who are being active and are getting what they need are the people who have to walk and cycle as part of their daily routine. And if you look at that graph on the bottom right hand corner, that shows you over the last 6 years how many minutes on average a Londoner spends travelling actively, and it's quite impressive. It's 22 minutes. On average. That means there's some people in London who are very active to compensate for the people who are doing almost nothing. And the red bits of those bars are walking and the bluey bits are cycling. So walking is really doing most of the work in terms of keeping Londoners active. The challenge we have is we've got 2 million adults and many children as well who need to be a lot more active than they are. And the way to get people to be active every day of their lives is to provide welcoming, inclusive street environments that everybody wants to get out into to walk and cycle. And this is an example from Lambeth in London. It's a street called Van Gogh Walk, and it was designed with human beings at the centre of the design process. Really thought about what do people need and want to create an amazing environment that they want to be in. Unfortunately, we can't make every street in London look like this because our streets have a number of other functions as well as being places for children to play and people to spend time and to interact with each other and to walk and cycle. Normally at this point, someone will ask me why I'm talking about physical activity when we're meant to be talking about mental health, but I think you're a pretty well-informed audience and you know some of the connections there. But more broadly, our street environments impact on our mental health in a whole range of different ways. And part of the reason why streets are so important, and part of the reason why I work at Transport for London, is that 80% of public space in this city is streets. So if we don't get our streets right, we basically don't have the public space that people need for good mental health and well-being. So the approach that we're taking at Transport for London is the Healthy Streets approach. And this is basically 10 key elements that every street needs to deliver if it's going to be a welcoming, inclusive, healthy environment for children to grow up and for people to live happy, long, healthy lives. And some of these have got quite obvious direct links to health, like air quality and noise and how safe people feel. And some of them are more to do with making sure we provide a street environment that is welcoming to walk and cycle in, and which the whole breadth of community can get out and use, not just the fit and the well. And not all of our streets look like that nice one with the children playing on. We've got streets like this to deal with as well. This is one of the core arterial roads in London, and trying to make that as healthy as the one that I showed you earlier is really challenging because we rely on these streets for carrying a huge amount of traffic around that brings all the goods and services around the city and move quite a lot of people around in large numbers as well. So we have a challenge on our hands. And unsurprisingly, we found that when we talk to Londoners and ask them how they think different streets are performing, streets like that one there tend to score the worst. So what this chart here shows you is the 9 different types of streets there are in London. So all of London's streets have been categorised based on how much of a place they are and how much traffic they need to move around. So the top left-hand corner, the arterial core roads, those are streets that are moving a lot of traffic around and we would say don't have a particularly high place function, and they score the worst. So the purple iceberg that you can see there is people's experience of being on those streets against the 10 indicators of a healthy street. And then the pink one next to it is what they would expect. So people expect streets to perform better than they do against our 10 indicators of a healthy street. And if you look at the streets down at the bottom of that chart, those are the ones that have got less traffic moving around on them and that maybe have more of a stronger place function, and they tend to score much better in terms of people's experience. So we need to try and improve our standards across the board really with our streets. Coming back to this street here, it's not all a challenging picture for us, because while we do have a lot of streets like this that we still need to do some work on, this street here now looks like this. So there's definitely some glimmers of hope for optimism in terms of delivering healthy streets in London.